Many studies have demonstrated what economics theory tells us must be true. When consumers have to pay more for their prescriptions, they take fewer drugs. That can be a big problem. This is Healthcare Triage News. Special thanks to Austin Frack, from whose Upshot column this episode was adapted. For some conditions, diabetes and asthma to name a few, certain drugs are necessary to avoid more costly care, like hospitalizations. This simple principle gives rise to a little recognized problem with Medicare's prescription drug benefit. For sicker Medicare beneficiaries, increased Medicare hospital spending exceeds any savings from reduced drug prescriptions and doctor's visits. Consider patients who need a drug but skip it because they feel the copayment is too high. This could increase hospitalizations and their costs, which would make them worse off than if they'd selected a higher premium plan with a lower copayment. This is analogous to what Medicare standalone prescription drug plans do. They achieve lower premiums by raising copayments. This acts to discourage the use of drugs that would help protect against other, more disruptive and serious healthcare use, like hospitalizations. Studies show that insurers, many of which are for-profit companies after all, are using such incentives to dissuade high-cost patients from enrolling or using the benefit. There's evidence this occurs for Medicare's drug benefit, as well as in the ACA's marketplaces. The most popular type of Medicare drug coverage is through a standalone prescription drug plan. A standalone plan never has to pay for hospital or physician visits. Those are covered by traditional Medicare. Another way to get drug benefits from Medicare is through a Medicare Advantage plan that also covers those other forms of healthcare and is subsidized by the government to do so. Because of this difference, standalone drug plans are less invested than Medicare Advantage plans in keeping people healthy enough to avoid some hospital visits. Studies have quantified the cost. Compared with Medicare Advantage plans, standalone drug plans charge enrollees about 13% more in cost sharing for drugs that are highly likely to help patients avoid an adverse health event within 2 months. They charge up to 6% more for drugs that help avoid adverse health events within a year. It's not as if stingier insurers are more likely to offer standalone plans than Medicare Advantage plans. Even among plans owned by the same insurer, Medicare Advantage plans are more generous in covering these kinds of drugs than standalone drug plans. Of course, people have choices about plans. Those who've selected a standalone drug plan, as opposed to a Medicare Advantage plan, have done so voluntarily. Why do some make this choice? One answer is that some people are not comfortable with the more narrow networks Medicare Advantage plans offer, with their fewer choices of doctors and hospitals. By choosing a standalone drug plan, they can remain in traditional Medicare, which has an open network. In addition, consumers are generally more attracted to lower premium plans than higher ones, even if the difference is totally made up in copayments. This may be because premiums are easier to understand than cost sharing. Moreover, premiums reflect a sure loss. You have to pay the premium to remain in the plan. A higher copayment, on the other hand, doesn't necessarily lead to a loss because you may not use a service. The appeal of lower premiums is an incentive for standalone drug plans to reduce them and increase copayments, but that can dissuade those who need medications from filling prescriptions and taking the drugs. Part of the purpose of Medicare's drug benefit is to encourage enrollees to take prescription drugs that can keep them out of the hospital. In July of 2003, promoting the legislation that created Medicare's drug benefit, President George W. Bush articulated this point, and I'm quoting him: "Drug coverage under Medicare will allow seniors to replace more expensive surgeries and hospitalizations with less expensive prescription medicine." But the design of Medicare's drug benefit includes standalone plans that aren't liable for hospital costs, so they don't work as hard to avoid them. Encouraging more beneficiaries into comprehensive plans, perhaps through Medicare Advantage, or offering a drug plan as part of traditional Medicare itself, might address this limitation. Healthcare Triage is supported in part by viewers like you through Patreon.com, a service that allows you to support the show through a monthly donation. Your support makes this show bigger and better. We'd especially like to thank our research associates Joe Sevitz and Jonathan Dunn, and of course our Surgeon Admiral Sam. Thanks, Joe, Jonathan, and Sam. More information can be found at patreon.com/healthcaretriage.